Hi there! Today we are diving into a topic that's surrounded by myths. Prostate cancer. Imagine this. Myths are like knots that can tangle our understanding. Well, we are here to untangle those knots and bring clarity to the truth. Here are 5 common prostate cancer myths that we are debunking. Myth number 1. No symptoms, no need for screening. Many people firmly believe that if they don't feel unwell or experience any symptoms, they must be in perfect health. They may react by saying, I am fine, so I must be in perfect health. No need for medical checkups. They often resist annual medical checkups, dismissing concerns friends and family who suggest otherwise. In reality, prostate cancer can often develop without noticeable symptoms, especially in its early stage. Early detection through screening is our first line of defense. Starting a conversation with your doctor about prostate cancer screening at age 40 is like preparing yourself for a potential challenge or problem before it becomes a serious issue. Just like wearing armor before going into battle. Feeling healthy doesn't always equate to being cancer-free. Prostate cancer can hide inside your body without showing any signs, and you may not know you have it until it reaches an advanced stage. Now, let's move on our next myth. Myth number 2. Diagnosis equals immediate treatment. Another misconception is that prostate cancer diagnosis always requires immediate treatment. People may react with panic, thinking that any cancer diagnosis requires immediate treatment and aggressive action. It's like hearing a single raindrop and rushing to build a shelter without assessing the weather forecast. Not all cases require immediate action. In some situations, especially with low-grade prostate cancer, active surveillance or watchful waiting may be considered. It's like assessing the battlefield before launching an offensive. It's crucial to understand that not all prostate cancer progress at the same rate. Some cases may stay inactive and not need immediate action, but others require treatment. Now, let's move on to another widespread misconception. Myth number 3. Prostate cancer is only for seniors. Believing that prostate cancer only affects older men is a common myth. Some may react by assuming that since they are young, they are immune to the disease. They might dismiss discussion about prostate cancer as not applicable at their age group. While it's true that most cases occur in individuals over 65, younger men can also get affected. It is important to recognize that risk factors vary, and discussion about screening options with your doctor should begin at age 40. Age alone does not grant immunity to prostate cancer. It can strike at any age, and the key is being alert and proactive in assessing your risk. Now, let's move on our next myth. Myth number 4. No family history, no risk. Some people assume that without a family history of prostate cancer, they are safe from it. Some people might think that because it doesn't run into their family, they won't get this condition. And they may not consider other things that could increase their risk. The risk exists for many, with 1 in 9 American men likely to face a prostate cancer diagnosis in their lifetime, regardless of family history. African American men are at higher risk, and genetics can play a role. It's essential to understand that while family history can increase risk, it's not the only factor that decides it. Now, let's move on to another critical aspect. Myth number 5. It's not a big deal. Thinking that prostate cancer isn't a significant concern is another misconception. Some people might not take the disease seriously and underestimate how serious it is until it affects them or someone they know personally. In reality, it's the most common cancer among men, excluding skin cancer. In 2023, an estimated 288,300 men in US. This is essential to recognize the gravity of prostate cancer. While it may come quietly, left unchecked, it can develop into a significant problem affecting not only physical health but also overall well-being. Now we have cleared this myth. Do you want to know the causes and symptoms of prostate cancer? Let me jump into it. Prostate cancer is a complex disease influenced by various factors such as age, family history, genetic, and ethnicity, which can increase its risk. Symptoms can include various issues related to urination, like PAN, frequent urination, or weak urine flow. Some people might also notice blood in their urine or semen, as well as discomfort in their pelvic area. Symptoms may extend to pain or discomfort in the lower back, hips, or thighs. Not taking good care of your body by not sleeping enough, eating irregularly, not exercising, and make bad food choices can increase your chance of getting prostate cancer. It is important to make healthier lifestyle choices to lower this risk. Prostate cancer originates from abnormal cell growth within the prostate gland. Although its exact cause remains unclear, the combination of genetic and other things in your body can make you more likely to get prostate cancer. Have a strong immunity is really important when it comes to fighting cancer. It helps both preventing cancer and in surviving it if you do get it. Furthermore, prostate cancer may present in additional symptoms like bone pain, loss of appetite, and unexplained weight loss. Therefore, our daily habits and choices have a significant impact on our risk factors, emphasizing the critical need to embrace a healthier lifestyle for overall well-being and cancer prevention. Our body immune system acts like a crucial shield against threats like cancer cells. A strong and well-nourished immune system, like a well-trained army, can effectively identify and eliminate potential dangers. It plays a pivotal role to maintaining health and survival when facing the possibility of cancer. Operating as a defense strategy, our immune system assesses the level of threat and determines the best approach. Sometimes it chooses to observe and wait. Much like a skilled general who carefully weighs options before committing to a battle. The strength of our immune system depends on various factors, including our lifestyle and dietary choices. Unhealthy habits and poor nutrition can weaken our immune system, reducing its effectiveness in fighting disease such as prostate cancer. Think of it as a soldier who lacks proper training and resources to defend the kingdom. Remember, knowledge is our weapon. The more we understand, the better we can protect ourselves and our loved ones. Before we finish, please support us by liking, subscribing, and sharing this important information with your friends and family. Let's clear this myth and arm ourselves with knowledge. Until next time, stay informed, stay alert, and keep spreading awareness.